Um, and then, we'll go into what kids can do to help themselves be more emotionally resilient, what we as parents can do to help them, on their sort of mental well-being journey. And then I want to touch upon two important topics, I think. One is sleep, and the other one is screen time. As parents, we all struggle with this, Alva, how much screen time to allow our kids. So I want to go into that a little bit. And then I also want to touch upon, aspects that are unique to us as Indian Americans. I think Vallabha was saying this. We've all moved here. We are trying to raise kids here. We are trying to ourselves understand the culture here as well as teach our kids to adapt this culture. So I just want to go into, some issues there. And finally, we'll conclude with, what can we take away from this talk? Because we're all spending time to understand this. So, what's the take home message? So that's the agenda for today. So really, what is mental health, Alva? I mean, even India, people talk about manasika arogya, manasika samasya. We're talking more about this in the last 5 to 10 years, but not enough, because we're afraid of this topic, because now when we say mental health, we immediately think of something extreme or something very negative. We say mental health equal to someone being crazy. But that's not true. I want all of us to think about mental health as something that is a foundation for our lives. It's a collective term for our emotional well-being, for our psychological well-being, for our social well-being. It affects how we think, how we feel, how we engage with people around us. I mean, and it impacts our relationships. It impacts their school performance. For us as adults, it impacts our work performance. And it also affects our physical health. From time to time, namgella enadru one mental health concern irutte. For example, today, even coming to this talk, I was a little stressed because, obviously I wanted to deliver something of value to all of you. So there was some amount of stress. And from time to time, we go through anxiety or we go through sleep issues, but those resolve. And that's not necessarily mental health disorder. But our symptoms, nammalli hage ulkondre, if it becomes persistent, if it becomes, if it goes to a point where you're not able to function, nidde madakatta illa, kelsadalli you don't take interest, you don't feel like eating, sleeping, then it becomes a mental health disorder, one that perhaps needs some attention. And again, there's a range of mental health disorders, so I've listed some for you in the slide. Next, Namma Maklu, right? Think about it. And this is a topic that's close to my heart. I mean, I don't work with children. I treat adults. I actually work for the VA, and most of my patients are military veterans. So I'm not a child psychiatrist, but I am a parent of 2 children myself. So hagagi, this is a topic that is close to my heart because I'm often looking at their own journeys and then trying to compare that to how I was raised, my own academic journey, India ಓದುವಾಗ ಹೇಗಿತ್ತು, exam pressure ಹೇಗಿತ್ತು. So compare ಮಾಡಿದ್ರೆ ಇಲ್ಲಿನ ಮಕ್ಕಳಿಗೆ they have a lot more demands and expectations on them. They have to do well academically, they have to get good grades, they have to, gain admission to elite colleges, they have to be superstars in sports, arts, extracurricular activities, and we don't know. They may also face things like, bullying or discrimination based on their ethnicity, their sort of religious ideas. So they go through a lot more. And of course, the cultural aspects, which I will get to in a future slide. So ಇಲ್ಲಿ ನಮ್ಮ ಮಕ್ಕಳಿಗಿರುವಷ್ಟು ಒತ್ತಡ ಖಂಡಿತ ನಮ್ಗಿರ್ಲಿಲ್ಲ when we were growing up. And I think as parents, we all need to be kind of mindful of that. Then, the question comes as to when do we recognize that that they're going through something serious, right? Because my friends often ask me, how is this not like a normal teenage tantrum? Is this not something that, that's part of growing up, right? Because teenage years nalli, they go through so many hormonal changes, they go through so many biological changes. So our experience ಮಾಡ್ತಾ ಇರೋದು, is it not something normal to them? That's a very good question, right? But to that, my answer is, you know your child best. So you know what their normal self looks like. But if you experience or if you see something which you think is not their normal behavior, then it's time to pay attention. And I've listed a few things on this slide to help you distinguish what is normal versus what is more serious. So if you see them, not sleeping, not eating, losing weight, not engaging with their friends, or changing their friends altogether, or doing poorly in school. I mean, if a child is excellent in school and all of a sudden does not want to go to school, or is not turning their quizzes on time, or just saying they don't like school at all, or they're consumed with a lot of self-doubt, or they're obsessing about one goal only. ನಾನು ಅದೇ ಕಾಲೇಜಿಗೆ ಸೇರ್ಬೇಕು, ಅದಿಲ್ಲ ಅಂದ್ರೆ ನಂಗೆ ಲೈಫಲ್ಲಿ ಏನೂ ಇಲ್ಲ. These extreme sort of ideas idre, then it's time for parents to say, something is going on here and I need to be there for them. And certainly more serious issues, like if your child is voicing thoughts of self-harm, that's not something that's going to go away on its own. Then it's really time to say, we need to get them some help on that. Some of the common issues that Illin Maklo they go through, clinical issues, are depression, anxiety, ADHD, which is more like difficulty with attention or focus. Then there's also eating disorders. I just listed a few. Of course, there's many more under the umbrella of mental health issues, but I think as parents we kind of need to be aware of these four. So what can kids do, right, to enhance their own emotional well-being? I mean, I don't know if there are kids in the audience today, but if there are, this message is for them. Emotional well-being, it's not a destination, it's more a journey. And the journey starts at a young age, just like it does with your physical health. Your parents will tell you, Alva, you have to eat right, you have to make sure, you get good nutritious food, you have to get some exercise. So those things start in childhood, and that's what translates to good health later on in your life. Adhe tara, even for emotional well-being, you have to inculcate certain practices now, right? And what kind of practices? Develop a good connection, a good network of trusted friends, trusted mentors. Get some type of activity. Don't just, it's very easy for us to be stuck in a chair all day long, at work, at home. It's important to get some movement, whether it's physical exercise, whether it's yoga. I know some kids in this kutumba, they learn yakshagana or some art form, music, dance, creative expression, simple things like, taking time to do some deep breathing. Even in the West here, they're looking at pranayama, breath work, those kinds of things. And then finding some quiet time. ಇಡೀ ದಿನ ಶಾಲೆ ಕೆಲಸ ಇರುತ್ತೆ, ಇಲ್ಲಾದ್ರೆ ಮನೆ ಕೆಲಸ ಇರುತ್ತೆ. There is no, like, in the modern world, there's nothing called 15 minutes of just quiet time. And unless we're intentional about it, like, making time to say, I'm just going to sit in peace, that's not going to happen automatically. And then don't forget time with nature, right? We're all, again, glued to screens or stuck to our chairs. We forget what a healing effect nature can have on us. So I think these are some things that, people can start doing at a young age, and make that a habit. And, because we're always telling our kids, be busy, be productive, do that, do this, but we never tell them rest. We never tell them relax. We never tell them pause. Our words they use ಮಾಡಲ್ಲ ನಮ್ಮ ಮಕ್ಕಳ ಜೊತೆ. So I think that is, something we all need to start doing. Then what can the parents do, right? So the first thing parents need to do is do everything I talked about in the previous slide. You know, keep reminding your kids to do everything that we just, went over. Because again, productive ಆಗಿರೋದು, it's a good thing for life. But then again, ನಮ್ಗೆ ನೋಡಿ ಈಗ, we don't know how to relax. We don't know how to take a break and not do anything. So that needs to become a habit. And then allow your children to fail. It's perfectly okay. They don't have to succeed in everything. Failure teaches you what your mistakes were. It makes you learn, it makes you grow, and that's how you build resilience. So naale munde life alli tondregalu bandaga, you already know what it feels like to fail. But one thing we all as parents do is we want our kids to succeed and excel and succeed and excel, but we never tell them that it's okay to fail. And the third thing is, create an open environment for your parents, for your kids to come and talk to you. They themselves don't know if they're having emotional issues. ಅವ್ರಿಗೆ ಗೊತ್ತಿರಲ್ಲ what they're going through, and they don't know, who to talk to. They just see all their peers are doing well, but they are struggling and they don't know who to talk to. So just tell your kids, I'm there for you. If you have a tough time or a tough day, you can come and talk to me, and listen more than you speak. Ido, I will give you a personal example. Nan maga, he's 21 now. And I think a few years back, he said, Mom, you never listen to me. Mom, you're always telling me what to do. And that was an eye opener for me, because because we are in a state of rush always, right? ಸೊ ಇದ್ ಮಾಡು, ಅದ್ ಮಾಡು, ಇದ್ ಮಾಡ್ಬೇಡ, ಅದ್ ಮಾಡ್ಬೇಡ, ಅಲ್ಲಿ ಹೋಗ್ಬೇಡ, ಹಿಂಗ್ ಮಾಡು, ಈ ವೀಕೆಂಡ್ ಇದ್ ಮಾಡೋಣ, ಅದ್ ಮಾಡು. We're always telling them what to do, but we never listen to them. And, that becomes important. So now I'm more intentional about it with my children. I make time to listen to them. How was your day? In ಮಾಡ್ತಾ ಇದ್ಯಾ? ಯಾರ್ ಜೊತೆ ಇದ್ಯಾ? Just simple things like this. And, be okay with silence, because they will not talk to you. In fact, kids here, I think after a certain age, prefer to communicate only via text. They don't like to pick up the phone and talk, because, text madidre, they control how much they talk to you. So, phone system alla namge. So, they just want to text and they just want to tell you how they're doing, and that's it. So, accept some silence from them. But as long as they know that their parents are there for them, they will come back. When they have difficulties, they will come back. And again, the last thing is, if you feel like this is going to a state where this is beyond your capacity to help them, then it's time to get them professional help. What that help looks like, I'm not going into that here, but that's a consultation with, your doctor. And that can look, that help can come in the form of medications. It can come in the form of therapy. That just depends on the individual situation, the individual clinical problem. But certainly, if you feel like, idu ನಾವು ಅವರಿಗೆ ಆಶ್ವಾಸನೆ ಕೊಟ್ಟು ಸರಿ ಮಾಡಕ್ ಆಗಲ್ಲ ಅನ್ಸಿದ್ರೆ, then it's time to get, help. And certainly there's benefits of treatment, alva. Oftentimes, in our own circles, we talk, really, what is mental health treatment? Adrinda help agata? How does it improve our lives? All I can say is, clinically, treatment is very effective. Just like, if you had a broken bone, and you'd go to an orthopedic doctor, or if you had diabetes and you would, get help from an internist, specialists, whether it's a psychiatrist or therapist, they're trained to do this. So, you just have to remember that there is certainly benefits to treatment. Now, I want to go into a couple of, unique topics, like I was telling you earlier, sleep. And idu makkaligaste alla, I know this is Yuva Vedike, but since there are so many adults here, we all forget the importance of sleep. Sleep is the one unsung hero in mental health. An average teen needs about 8 to 10 hours of good sleep. And CDC kuda, what it says is that, 70% of American teens don't get enough sleep. And why? Because of all the things we talked about, right? There's so many pressures on them: academics, so club activities, college prep, sports, addu, iddu. They do barely get like 5, 6 hours of good sleep. And this is also at a time when their bodies are changing, when their natural sleep rhythms are changing. They tend to sleep later and later. ಮಕ್ಕಳಿದ್ದಾಗ ಎಷ್ಟು ಮಲಗ್ತಾರೆ, they don't sleep as much when they're teens or young adults. And so on top of this, if they get even less sleep, you can be sure that this is setting them up for some kind of emotional issue in the future. Because when you don't sleep, you're grumpy. When you don't sleep, you have mood swings. You can't focus, you can't remember things. And if they're driving, they're young adults and they're starting to drive, then you have to be careful because they're susceptible to accidents. So the one thing I think, what can we as parents do, Andre? Make sure your kids are getting enough sleep. And the children who are doing academically well, they're getting even less sleep because they're working harder and they're working at night. And unfortunately, those kids are more prone to mental health issues than kids who sleep better. So as parents, ensure that there are regular sleep patterns, ensure that they're getting good number of hours, weekday-ish to weekend-ish to, now we tend to slip alva. Weekend band kudle, we are so busy with so many activities that our own sleep cycle gets messed up. But I certainly hope that this is something we can all take away from this today. And then, device management. So this is another bane of modern society, Alva. I mean, we all live in a digital age, and our phones, our iPads, our computers are really an extension of all of our lives. So it's, how do we get away from this? I don't think anybody knows the answer. But what we do know is it harmful? It absolutely is. So the more kids are on social media or spending time online, it does increase the risk of anxiety, depression, loneliness, other kinds of psychological distress. And then they look at their peers, they see beautifully curated representations of their peers, because nobody puts anything negative about themselves on social media. So when your kid is struggling to form their own identity and all they see is, ಅವರಲ್ಲಿ ಹೋದ್ರು, ಅವ್ರು ಹೀಗ್ ಮಾಡಿದ್ರು, that tends to impact them negatively. So again, I'm trying to give you a problem in one slide and some solutions in the next slide. So I hope this is helpful. So what do we do about screen time? Nothing really. All we can do is be good role models ourselves. We can only lead by example. And you tell your kids that, yes, screen time, can be a bridge. It can be a bridge to help you make friends. It can be a bridge to develop some connections, but it can't replace real life connections. It can't replace real life experiences. It can't take away from, going for a walk, taking your dog out for a walk, talking to the neighbors. It can't replace any of that. So adike we have to establish some house rules. And more importantly, educate your teens that about the platforms they're using, because it can be dangerous. I mean, when you have a digital life, then you should know also about the risks that go along with it. And I think as parents, it's also our job to tell them, what the dangers are of putting yourself and how much information to put out there, because it's available to all. Alva? And lastly, why are your kids on online so much? And that's something I think we as parents need to see. Is it because they're lonely? Is it because they're bored? Is it because they don't have other hobbies or physical activities? So that's something I think we need to look into, and maybe come up with some solutions so that we get to the root of the problem, rather than just tell them, don't be online, or you're done for the day. Then what should they do, Alva? So we need to figure that out first. I see Dr. Katpadi or join agidave. Hi, Manmohan. So next thing, I think this is the most important piece of the talk today. cultural aspects. ಹೇಗೆ ನಮ್ culture, can influence mental health. When I say num culture, I'm not only talking about, being Indian Americans, but also our own unique cultures ಅಲ್ವಾ. ಇಲ್ಲಿ ನಮ್ಮಲ್ಲೂ ಕೂಡ we're all different in so many ways, depending on which part of India we come from, what language we speak, ನಮ್ಮ ಆಚಾರ ವಿಚಾರ ಏನು, based on that. So that certainly can make it difficult for our kids, because they have to navigate the complexities of cultural identity, and that can be a source of both pride and pressure for them. As Indian parents, we all want our kids to succeed. We want them to, be affluent. We want them to be obedient. We want them to be intelligent. We want them to do well in life. Essentially, live the American dream. And our kids get that. They see how hard the parents work, and they get that, and they want to do that. But it imposes so many expectations on them. So then what they have to do because of these cultural values is they have to respect authority, they have to conform to social norms, family honor uphold ಮಾಡಬೇಕು, ಮತ್ತೆ they have to control their emotions because they have to be successful. So this imposes a lot of pressure on them. And then whether implicitly or explicitly, we tend to convey the message that we've done a lot of sacrifices for them to be here, and we somehow tend to give them that message. And so then by extension, we expect them to represent our families well to the larger society. So again, that is somewhat of a burden on them. And then there is the stress of biculturalism. ಈ term ಕೇಳಿರ್ಬೋದು ನೀವು. What it essentially means is, ನಮ್ಮ ಮಕ್ಕಳು they belong to two cultures essentially, right? The one that they are exposed to at home and the one that they see outside the house. And sometimes, these two cultures or values can be at odds with each other. So when they go and interact with their peers, or when they go and interact with their teachers or their neighbors, what they learn at home might be at odds with that. And they have this tremendous pressure of trying to fit in and also not disappoint either of the cultures. So think about it from a child's standpoint. I mean, that's really hard to reconcile. And lastly, of course, nammalli, there is still the shame and stigma of talking about mental health issues. Because, essentially now we believe in karma, right? We believe whatever it is that life hands out to us is God given. And ನಾವು ಹೇಳ್ತೇವಲ್ವಾ, ಬಂದಿದ್ದೆಲ್ಲ ಬರಲಿ, ಗೋವಿಂದನ ದಯ ಒಂದಿರಲಿ. And nothing wrong with that. Even as a practicing clinician, I encourage my patients to rely on faith, because holistically, you need everything. You need clinical help, you need spiritual help, you need social help to lead a good quality life. So there is nothing wrong with that. But at the same time, sometimes it might be beyond just those interventions. Clinical help necessity irbahudu. And unfortunately, there is still some fear in asking for help. There is still some shame in asking for help, because now we think that, people might look at us as having failed something, or we think that it is shameful to ask for help. And that's where, people might hide their symptoms. And I hope that conversations like this makes it easier for people to ask for help. So again, so what can we do in our own communities to help people get the help that they need, Alva? So I think the first step starts with, balance your expectations with welfare. Andre, it's okay to emphasize on grades and performance, but I think the bigger focus should be to encourage a love of learning. It's not about getting the perfect grades. Let them be curious about learning. Let them go explore things, pursue their passions. It's not just about getting the perfect grades. Second, accept uniqueness. Andre, every child is different, right? Not everyone is cut out to be, a doctor or a lawyer or an engineer. And I think the world is beautiful because we have people with different talents. So I think we all need to embrace that, even if, our children are making unusual choices outside of social norms. I think it's okay. And we should be okay with that. ಆಮೇಲೆ ಎನ್ಕರೇಜಿಂಗ್ ಫೈನಾನ್ಷಿಯಲ್ ಲಿಟ್ರಸಿ ಇದನ್ನ ನಾನು ಇಲ್ಲಿ ಇನ್ಕ್ಲೂಡ್ ಮಾಡಿದೆ ಬಿಕಾಸ್ ಅಫ್ಕೋರ್ಸ್ ವಿ ಆಲ್ ಹ್ಯಾವ್ ಸಮ್ ಆಫ್ ಅಸ್ ಹ್ಯಾವ್ ಕಾಲೇಜ್ ಗೋಯಿಂಗ್ ಕಿಡ್ಸ್ ಅಂಡ್ ಸೊ ವೆನ್ ಐ ಟಾಕ್ ಟು ಮೈ ಓನ್ ಫ್ರೆಂಡ್ಸ್ we all want to support our kids financially, but I think the bigger goal should be to help them make their own decisions, so help them understand the fundamentals of finances so they can make their own decisions. So now if they come into a bind, if they have some kind of financial stress, then they can work their way out of it, because aga appa amma iralla. So I think it is about making sure that they're ready to take on life and not just, handing it to them. So these are some things I think that we as a community can work on. And then I also put conditional versus unconditional love, right? So unconditional love andre liking your children, loving them for who they are, no matter what, versus conditional love, which is like sending them a message that they have to do something to earn that love, that they have to fulfill a certain expectation to earn that love. Adrinda, you may get more achievement. Yes, our kids might achieve more, but it's not without negative consequences. There may be low self-worth, resentment, guilt, shame. ಹೀಗೆಲ್ಲ ಇರುತ್ತೆ. So, just the simple thing is accept your kids for who they are and love them unconditionally. So that kind of brings me to the end of my talk. I mean, at the end of it, I think this is what I want all of us to remember as we move forward, right? Mental health is an important part of human health. Just like physical health, it is certainly an essential part of human health. And it's not about waiting till you have a problem and then trying to find a solution. Just like we do with physical health, I think we have to proactively work towards good emotional well-being. So although it starts in childhood, so remember the things we talked about earlier, encourage them to have a good network of friends and trusted mentors, teach them, to the transformative power of a creative hobby, not just, academic stress. Encourage them to follow a passion that they enjoy, because later on also, exam, like say they're in college, right? They get tired of studying for an exam. They can just sit and play the violin for a few minutes, and that can have like a powerful calming effect. Teach them the value of being outside in nature. Teach them that it's important to get good sleep. Teach them that it's okay to relax. Teach them that, it's okay to just say, I'm not good at this. I failed at this, and that's okay too. So those are the things that, I hope we can all take away from this talk. And certainly resources. I think, if you do see that somebody is struggling with help, it may not be someone in your own family, but, friends or neighbors, ask them to get help. I mean, you start with your primary care doctor or your pediatrician. If they feel capable of helping, then they will. If it's beyond their expertise, they will refer you to a specialist. You can find someone in your network and get the treatment you need. But certainly if you are in crisis, or if you know someone who's, in crisis, and I'm thinking about those children that we lost recently, a call to the crisis line perhaps would have, helped them. And 988 is the number, and this service is available 24/7. It's free, it's confidential. They can certainly walk you through the crisis and then make sure that you're linked with an expert that can help you. So hopefully, well, I did have a video, but ಅದು ಸರಿಯಾಗಿ embed ಆಗಿಲ್ಲ, so I will not be able to play the video. But yeah, that brings me to the end of my talk. I'm happy to take any questions, or if you all have some thoughts, we can have a discussion.
Thank you so much, Deepa. I will pause the recording because I could start the recording earlier on. So I'll pause the recording.
Both parents as well as kids. Simple words use ಮಾಡಿ ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾತಾಡಿದ್ರಿ. ಆ ಇಂಪಾರ್ಟೆನ್ಸ್ ಮೆಂಟಲ್ ವೆಲ್ಬೀಯಿಂಗ್, ಫಿಸಿಕಲ್ ವೆಲ್ಬೀಯಿಂಗ್ ಜೊತೆ ಮೆಂಟಲ್ ವೆಲ್ಬೀಯಿಂಗ್ ಕೂಡ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತೇಳಿ ಹೈಲೈಟ್ ಮಾಡಿದ್ದು ತುಂಬ ಒಳ್ಳೆಯದಾಯಿತು. ಬಿಕಾಸ್ ನಾವು ಹೆಚ್ಚಾಗಿ ಮನೆಯಲ್ಲಿ ಅದು ನೀವು ಹೇಳಿದಾಗೆ ಊಟ ಮಾಡಿದ್ಯಾ, ಅದು ಮಾಡಿದ್ಯಾ, ಅದನ್ನು ಕೇಳ್ತಾ ಇರ್ತೀವಿ ಹೊರತು ಅವರು ಮೈಂಡಲ್ಲಿ ಏನಾಗ್ತಾಯಿದೆ, ಅವ್ರಿಗೆ ಎಷ್ಟು ಸ್ಟ್ರೆಸ್ ಇದೆ, ಎಷ್ಟು ಪ್ರೆಷರ್ ಇದೆ, ರೈಟ್. ನಮ್ಮ ಮನೆಯಲ್ಲೂ ಇಬ್ಬರು ಮಕ್ಕಳಿದ್ದಾರೆ, ಹೈಸ್ಕೂಲಲ್ಲಿದ್ದಾರೆ. ಯು ಕ್ಯಾನ್ ಕ್ಲಿಯರ್ಲಿ ಸಿ ದ ಡಿಫ್ರೆನ್ಸ್. ಎಲಿಮೆಂಟರಿ ಸ್ಕೂಲ್ ವರ್ಸಸ್ ಹೈಸ್ಕೂಲ್ ಬಂದ ತಕ್ಷಣ ಸೋ ಮೆನಿ ಥಿಂಗ್ಸ್ ಆಗಿರೋ ಡೀಲ್ ಬೇಕು. ಪ್ಲಸ್ ನಾವು ಆ ಕ್ಲಾಸಿಗೆ ಹೋಗು, ಈ ಕ್ಲಾಸಿಗೆ ಹೋಗು, ಡ್ಯಾನ್ಸ್ ಕ್ಲಾಸ್ಗೆ ಹೋಗು ಎಲ್ಲ ಅದು ಹೇಳ್ತೀವಿ. ಬಟ್ ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾತಾಡಿದ್ರಿ. ಇನ್ನೊಂದು ಟಾಪಿಕ್ ನೀವು ಹೇಳಿದ್ದು ಫೈನಾನ್ಷಿಯಲ್ ಲಿಟ್ರಸಿ, ರೈಟ್. ನಾವೆಲ್ಲ ಬೆಳೀತಾ ಇರಬೇಕಾದ್ರೆ ನಮಗೆ ಪೇರೆಂಟ್ಸ್ ದುಡ್ಡು ಕೊಡ್ತಾಯಿದ್ರು, ಕ್ಯಾಶ್ ಕೊಡ್ತಾಯಿದ್ರು. ಅದನ್ನು ಕ್ಯಾಶನ್ನ ನೀವು ಯಾರಿಗೊಬ್ಬರಿಗೆ ಕೊಡಬೇಕಾದ್ರೆ ಅದರ ಪೇಯ್ನ್ ನಮಗೆ ಫೀಲ್ ಆಗ್ತಾಯಿತ್ತು, ರೈಟ್. ಸೊ ನಾವು ಸೇವ್ ಮಾಡ್ತಾಯಿದ್ವಿ, ಸ್ಪೆಂಡ್ ಕಡಿಮೆ ಮಾಡ್ತಾಯಿದ್ವಿ. ಅದೇನಾಯಿತು, ಕ್ಯಾಶ್ ಹೋಗಿ ಕ್ರೆಡಿಟ್ ಕಾರ್ಡ್ ಬಂತು. ಬಟ್ ಈಗ ನಮ್ಮ ಮಕ್ಕಳೆಲ್ಲ ಡೀಲ್ ಮಾಡಬೇಕಾದ್ರೆ ಆ ಕ್ರೆಡಿಟ್ ಕಾರ್ಡ್ ಈಸ್ ಆಲ್ಸೋ ಹಿಡನ್. ನೀವು ಅಮೆಝಾನ್ಗೆ ಹೋದರೆ ಅಲ್ಲೆಲ್ಲೋ ಆ್ಯಪ್ ಒಳಗಡೆ ಇಟ್ಸ್ ಹಿಡನ್, ಊಬರ್ ಯೂಸ್ ಮಾಡಿದ್ರೆ ಇಟ್ಸ್ ಹಿಡನ್, ರೈಟ್. ಸೊ ಆ ಮಕ್ಕಳಿಗೆ ಅದನ್ನು ಯಾವ ಥರ ಎಜುಕೇಟ್ ಮಾಡೋದು, ರೈಟ್. ಇಟ್ ಫೀಲ್ಸ್ ಆಸ್ ದೋ ಲೈಕ್ ಫ್ರಿಜ್ ಹತ್ರ ಹೋಗಿ ವಾಟರ್ ಅಥವಾ ಐಸ್ ತೊಗೊಂಡಾಗೆ, ರೈಟ್. ಇಟ್ಸ್ ಎಲ್ಲೋ ಫ್ರೀಯಾಗಿ ಬರ್ತಾ ಇದೆ ಅಂತೇಳಿ. ಹೌ ಡು ವಿ ಎಜುಕೇಟ್ ದೆಮ್ ಆನ್ ಫೈನಾನ್ಷಿಯಲ್ ಆಸ್ಪೆಕ್ಟ್ಸ್, ರೈಟ್. ಆಗ ಅಶೋಕ್ ಅವ್ರು ಹೇಳಿದಾಗೆ ಸಡನ್ ಆಗಿ ಕಾಲೇಜಿಗೆ ಹೋದಾಗ ಅಥವಾ ಅದಾದಮೇಲೆ ದೆನ್ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ಟು ಮ್ಯಾನೇಜ್ ಆನ್ ದರ್ ಓನ್, ರೈಟ್. ಮ್ಯಾನೇಜ್ ಮಾಡೋದು ಮಾತ್ರ ಅಲ್ಲ, ಇಫ್ ದೇ ಗೆಟ್ ಇನ್ ಟು ಎಸ್ಪೆಷಲಿ ಇನ್ ದ US, ರೈಟ್. ವೆದರ್ ಇಟ್ಸ್ ಸ್ಟಾಕ್ ಮಾರ್ಕೆಟ್ ಇರ್ಬೋದು, ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಮಾರ್ಕೆಟ್ ಇರ್ಬೋದು, ಎನಿಥಿಂಗ್ ಇಟ್ಸ್ ಲೈಕ್ ಇಟ್ ಗೋಸ್ ಅಪ್ ಆ್ಯಂಡ್ ಡೌನ್, ರೈಟ್. When somebody loses their job, someone faces hardship, how do they deal with that? But ಎಲ್ಲ ಟಾಪಿಕ್ ನೀವು ಚೆನ್ನಾಗಿ ಮಾತಾಡಿದ್ರಿ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಆ್ಯಂಡ್ ಇದೇ ಥರ ಐ ಥಿಂಕ್ ಇದನ್ನೊಂದು 3 ಮಂತ್ಸ್ಗೆ ಒಂದ್ಸಲ, 6 ಮಂತ್ಸ್ಗೆ ಒಂದ್ಸಲ ರಿಪೀಟ್ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂತ ಅನ್ನಿಸ್ತು ನನಗೆ. ಪ್ಲಸ್ ನಿಮ್ಮ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್, ಎಕ್ಸ್ಪರ್ಟೈಸ್ ಇಸ್ ಕ್ಯಾನ್ ಬಿ ವೆರಿ ಯೂಸ್ಫುಲ್ ಟು ಕುಟುಂಬ. ವೆಲ್ಕಮ್ ಟು ಕುಟುಂಬ. ಬನ್ನಿ, ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿ, ಸಪೋರ್ಟ್ ಮಾಡಿ. ಥ್ಯಾಂಕ್ ಯು.
Thank you. Once again, I will start with Dr. Katpadi. Avru matadi anta, he encouraged me to do it. Vallabha, sorry, I was not very timely in getting back to you, but I'm glad it all worked out. And once again, I apologize that it had to be rescheduled from yesterday. But thank you all for your participation. And even after this, if you have any questions that I can be of any help, Kandita reach out ಮಾಡಿ.
Yes, and ನೀವು ಹೇಳಿದಾಗೆ you were very right in your observation. This is more of the parents who have joined. We will do something with your schedule permitting with the kids so that they are with you, and now I think with the parents also being listening to you, they may also be comfortable. So ಒಂದು ಮಕ್ಕಳ ಜೊತೆಗೆ ಒಂದು ಸೆಷನ್ ಮಾಡ್ತೀವಿ. I'll reach out for a future date.
No problem. I think it would be helpful to maybe start with some questions from them, alva? Like, yes. What do they want to know? So we can get a talk towards that. Mm-hmm. What do they face in school? What kind of help do they want at home? What are some of their challenges? Ivaga Chetna ಹೇಳಿದ್ರಲ್ಲ, the kids feel that they're not heard. So maybe starting with, what they want, and we can then think of ways to help them.
Sure. We have a lot of work, and we are in together, so we'll reach out soon. But thank you so much for your time.
And
no problem.
Vallabhakka and Vijayanna plus the rest of the youth committee members and youth advisors, thanks for organizing such a wonderful session. And thanks to all the Kudma members for joining this session. And thanks Santoshana and Akshataka and rest of the executive committee members. Thank you.
Srishana, I had to acknowledge Deepaka. Nano Vallabhakka, when she called me, I was in one small puja. ಅದಕ್ಕೆ ಐ ವಾಸ್ ರಿಕ್ವೆಸ್ಟಿಂಗ್ ಹರ್. ಅಕ್ಕ, ಇಟ್ ವಾಸ್ ವಂಡರ್ಫುಲ್ ಸೆಷನ್. ಯಾಕಂದ್ರೆ ನೀವು ಫಸ್ಟ್ ಬ್ರಹ್ಮವರ ಅಂತ ಹೇಳಿದಾಗ, ಅಂಡ್ ಯು ಆಲ್ಸೋ ಟೋಲ್ಡ್ ದಟ್ ಯು ಆರ್ ಫ್ರಮ್ ಶಿವಳ್ಳಿ. ಐ ಆಮ್ ಆಲ್ಸೋ ಫ್ರಮ್ ಬ್ರಹ್ಮವರ. ಸೊ ಇಟ್ ಮೇಡ್ ಮಿ ಫೀಲ್ ಸೋ ಮಚ್ ಕನೆಕ್ಟೆಡ್, ನಂಬರ್ ಒನ್. ಅಂಡ್ ನಂಬರ್ ಟೂ ಇಸ್ ಶಿವಳ್ಳಿ ಕುಟುಂಬ. ಸೊ ಈ ಮೆಂಟಲ್ ವೆಲ್ ಬೀಯಿಂಗ್ ಅಕ್ಕ, ನಾವು ವೆನ್ ವಿ ಹ್ಯಾಡ್ ಲಾಟ್ ಆಫ್ ರೀಸೆಂಟ್ ಇನ್ಸಿಡೆಂಟ್ಸ್, ಆಗ ವಲ್ಲಭಕ್ಕ ದ ಫಸ್ಟ್ ಕಾಲ್ ಅಂಡ್ ಮೆಸೇಜ್ ದಟ್ we had was we have to do something for our community ಅಂತ ಹೇಳಿ. So ಕುಟುಂಬ ಹೇಳಿದಕ್ಕೆ we have always responded instantly, and we have brought lots such many programs, and we are also equally thankful. ನಿಮ್ಮ ಹಾಗೆ ತುಂಬಾ ಜನ ನಮ್ಗೆ ಬಂದು ಗೈಡ್ ಮಾಡಿದ್ದಾರೆ, ಸಪೋರ್ಟ್ ಮಾಡಿದ್ದಾರೆ, ಸಜೆಸ್ಟ್ ಮಾಡಿದ್ದಾರೆ. ಯಾಕಂತ ಹೇಳಿದ್ರೆ ಯೂತ್ಗೆ ಇಟ್ಸ್ ಆಲ್ ಆನ್ ಗೋಯಿಂಗ್ ಪ್ರೊಸೆಸ್ ಅಲ್ಲ, ಇದೆಲ್ಲ ಒಂದು ದಿವಸದಲ್ಲಿ ಕಲಿಯುವಂತ ವಿಷಯಗಳಲ್ಲ. ಪ್ಯಾರೆಂಟಿಂಗ್ ಈಸ್ an art. So few things we have to learn, few things we experience it, then so it's ongoing process. Now many of us, ನೀವು ನೋಡಿದ್ರೆ US ಅಲ್ಲಿ, we all discuss ನಿಮ್ಮ ಮಕ್ಕಳಿಗೆ ನೀವು ಹೇಗೆ ಹೇಳಿಕೊಡ್ತೀರಿ, ಹೇಗೆ ನಮ್ಮ ಕಲ್ಚರ್ ಪಾಸ್ ಮಾಡ್ತೀರಿ. ನಾವು we all learn from a word of mouth, but when we hear from you untala, it's a real time experience. ಯಾಕಂದ್ರೆ you are the one who will be treating, you know what exactly is happening.
Believe me, I also make a lot of mistakes with my kids. It is it is a constant learning process. Nobody told us parenting was easy, but and certainly, I think I'm a better parent with my second child than I was with my first one. So, we're all learning.
Yeah, right. ಮತ್ತೆ ಶ್ರೀಶಣ್ಣ ಹೇಳಿದಾಗೆ, ನಾವು ಸಣ್ಣದಿರುವಾಗ ನಮ್ಮ ಪ್ಯಾರೆಂಟ್ಸ್ ನಮ್ಗೆ ಗೊತ್ತಿಲ್ಲದೆ ದೇ ಹ್ಯಾಡ್ ಥಾಟ್ ಲಾಟ್ ಆಫ್ ಥಿಂಗ್ಸ್. ದ ಫೈನಾನ್ಷಿಯಲ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, ದೇ ನೆವರ್ ಟೋಲ್ಡ್ ದಟ್ ನೀನು ನಿಂಗೆ 100 rupees ಕೊಡ್ತೇವೆ, ನೀನ್ ಈಗ ಖರ್ಚು ಮಾಡು ಅಂತಲ್ಲ. ಬಟ್ ದರ್ ವಾಸ್ ಅ ಆರ್ಟ್ ಆಫ್ ಟೀಚಿಂಗ್. ಬಟ್ ಈಗ ಏನಾಗ್ತಾ ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಪ್ರಾಬ್ಲಿ ವಿ ಆರ್ ಮೋರ್ ಪ್ರೊಟೆಕ್ಟಿವ್ ಅಬೌಟ್ ಅವರ್ ಕಿಡ್ಸ್. ನಾವು ಅವರಿಗೆ ತುಂಬಾ ಎಕ್ಸ್ಪ್ಲೋರ್ ಮಾಡ್ಲಿಕ್ಕೆ ಬಿಡ್ತಾ ಇಲ್ಲ. ಸೊ ಪ್ರಾಬ್ಲಿ ದಟ್ ಈಸ್ ಸಮಥಿಂಗ್ ದಟ್ ಆಲ್ ಆಫ್ ಅಸ್ ಹ್ಯಾವ್ ಟು ಲರ್ನ್. ಯಾಕಂದ್ರೆ ವಿ ಆಲ್ ಹ್ಯಾವ್ 1 or 2 traits, ವೆರಿ ಪ್ರೊಟೆಕ್ಟಿವ್. ವಿ ಡೋಂಟ್ ಪ್ರೊಟೆಕ್ಟೇಬಲ್ ಆಗಿರ್ಬೋದು.
ಇಲ್ಲ, ಸ್ವಲ್ಪ ಮಧ್ಯದಲ್ಲಿ ನಂಗನ್ಸುತ್ತೆ ನನ್ನ ಕನೆಕ್ಟಿವ್. ಗೋ ಆನ್ ಸಂತೋಷ್.
ಸೊ ರೀಸೆಂಟ್ಲಿ ನಾನು ಒಂದು ಇಂಡಿಯನ್ ಕಪಲ್ಸ್, ದೇ ವರ್ ಗಿವಿಂಗ್ ಒಂದು ಸ್ಮಾಲ್ ವಿಡಿಯೋ ಕ್ಲಿಪ್, ಅವರ ಪ್ಯಾರೆಂಟಿಂಗ್, ಹೌ ಟು ಮ್ಯಾನೇಜ್ ಫೈನಾನ್ಷಿಯಲ್. ಸೊ ಅವ್ರು ಏನ್ ಹೇಳ್ತಾ ಇದ್ರು ಅಂತ ಹೇಳಿದ್ರೆ, ದೇ ಮೇಕ್ ಶೋರ್ ದಟ್ ದೇ ಟೇಕ್ ದಿಯರ್ ಕಿಡ್ಸ್ ಟು ರೈಟ್ ಫ್ರಮ್ ವೆಜಿಟೇಬಲ್ ಶಾಪ್ ಟು ಇದು ಯಾವುದು ಡ್ರೆಸ್ ಶಾಪಿಂಗ್ ಇರ್ಬೋದು, ಏನೇ ಇರ್ಬೋದು. ಸೊ ದೇ ಟು ಗಿವ್ ದೆಮ್ $20 or some amount and allow them to take that decision. So see, it's an ongoing process. Or when they go, they choose which vegetable to buy, all those things untala, how to save that. There are a lot of things that all of us, on the fine day when our kids go to college and we want them to manage, probably it's a very difficult task. So I mean, we are also learning. But Ujwalaka, I will not take much time. I had to, because I was driving. Thank you so much. It was a wonderful session. We will keep bothering you with whenever we have any concerns, questions, and we'll reach out to you for any feedback, suggestions that we might have. So please do support us, encourage us, and help, because Kutumba is all about helping our own people. Namma community, we have left India, and one good thing is, last 3 years we have connected more than 1,000 families, and we are counting. There are a lot of families getting added, because as a group we have engaged all the community. I mean, all the age group, not just youth, but youth is very close to heart this term, and we look forward for your continuous support. Thanks once again, Akka. It was wonderful listening, and the wonderful PPT presentation. Thank you so much.
You're very welcome. Namaste.
Thank you, everyone. Have a wonderful rest of the evening. So talk to you soon at our next UI Vedika event. Thank you.